Thank you so much for this opportunity to interview you for the Footprint Project, Dr. Moses Mwangi. From your experience and from the work that you've been doing, you're an inspiration to most of us as young professionals, especially young pharmacists, and we'd be glad to learn about the journey that you're leading and the kind of work you're leading. So maybe you just tell us more about the work you're currently dealing with, the Equatorial Nut Processing, and a brief on other initiatives that you are currently focusing on as we start off here.
So thank you very much. This year, 2023, I am working at Equatorial Nut Processors. I joined this company in 2014 as the Chief Executive Officer at a time when the company was diversifying from manufacturing or rather processing traditional nuts, that's macadamia, peanuts, and cashew nuts, into nutrition in health by manufacturing fortified blended food. This is it's called FBF, fortified blended food. It is based on corn, soya. Soya, you know, is the best source of protein in plants, and corn. We have a technology we call extrusion technology. So whereby we pre-cook a kind of a designer product, depending on who we want to target. The main issue we are addressing is mild acute malnutrition. So this product we fortify with essential vitamins and minerals that are sourced from a World Health Organization pre-qualified laboratory. The idea here is to deliver the right kind of calories, the right kind of vitamins and proteins, and you know, it's a porridge. It's a full meal, so that a person suffering or a person who is living with the HIV and AIDS and has this nutrition, which they take as a porridge, they have full nutrition, and it's able to help build the body's capacity to fight. Now, mild acute malnutrition is a global health problem. Here in Kenya, it affects 30% of children below 5 years, especially children who are growing in arid and semi-arid areas. Some of the counties like Pokot will have a higher malnutrition, and also in informal settlement areas, it's a problem. So besides HIV and AIDS, we are targeting children and working with counties and the national government to do what we call school feeding program, where we deliver this porridge at break time. So that is what I'm currently doing. We started in 2014 November, and you know, and we are growing. So we are also looking at installing another plant which we are building in, and it should be operational July, August, September, to manufacture ready-to-use therapeutic food targeting severe acute malnutrition, which is responsible for at least 1 million deaths of children below 5 years, and largely in sub-Saharan Africa, of course, in conflict areas, like currently have problems in Syria and places where there is conflict and people are displaced. You know, they may not always get the right nutrition. You know, these products are quite useful. So that is what I'm doing as a professional pharmacist. As you grow older, you also tend to find a lot of value in reaching out and impacting communities. For many years, when I settled in Kahawa West after my university, and then I joined the local church there, I became an elder. We put up a school, and I'm the executive chairman. We currently have 3 campuses, the KBA group of schools. We have 2 primary schools, and early this year we started the KBA Junior Secondary School. We are touching almost 3,000 children. So I have over 200 employees, and you know, I'm very happy to shape the future of so many children. This is something I've done alongside my career, but now more and more, giving more and more time to build this institution.
That's wonderful. That's wonderful. And actually, I would want to ask you two questions based on the information that you've shared. One, from the Equatorial Nut Processing, what particular key skill sets do you have that you are applying to this particular line of work? Let's say, for example, you're training as a pharmacist, your experience working with the biopharmaceutical companies and current advances that you're making. What particular skill sets are critical for you that you're applying for that, actually, that a professional, a young pharmacist, a young professional somewhere would draw on those particular skill sets to apply in this kind of job? Then beyond that, the other key question that I would be keen to understand is, from these impacting communities and making a difference, what particular capabilities and additional skill set do you think are coming in that space where you feel like, why is education? Impacting communities, there are people who are doing them in different approaches. So why did you choose education, and why is this something that is very critical for you as a professional?
Now, first of all, the training of a pharmacist, I must appreciate now, going back to my college days. I think there is quite a diverse ways in which a pharmacist can apply themselves. Besides being a scientist, a good scientist who understands medicine, our science, our pharmacies is also quite social. You know, there's that interaction with the community, whether it's at a community pharmacy level. You largely deal with not only sick people, but also people who need help on a day-to-day basis. Besides the capacity to also work in the hospital setting and in industry. I joined the industry myself from very early as a company pharmacist and in drug development. Got involved quite early in manufacturing, you know, the GMP and all that we all know about, in regulatory affairs. You know, this was in my base as a career when I joined a multinational very early, and I was involved in local production of very top medicines, you know, and so I developed the skills of quality management systems, you know, and those skills of quality management systems can be applied anywhere. Because whether you're producing a medicine or you're producing therapeutic food, or you are producing food, even for the children, you know, mild acute malnutrition, you know, those products must be, you know, we are ISO certified. You know, we have the highest certification, the highest FSSC 22,000. So that's, you know that experience as a pharmacist and the quality management system puts you on the cutting edge, either in the manufacturing that I'm still doing, or in management, because management also you need processes. You need to manage, you know, their business processes, whatever they are, whether it's in a hospital setting or in a school setting, their processes. And I found myself, for example, in the KBA group of schools, in the same way as in Equatorial Nut Processors, in the same way as when I was working for Sanofi, I found that we have to work with policies. So management policies. Of course, along the way, when I was a manager in the pharma industry, I also not only gained the experience through the training that I acquired, but also I went back to school and did MBA, which helped me to clarify, you know, the theories and practice of management, which you then apply whatever it is that you go So, so that training of the pharmacist, and then the exposure to quality management systems, and then honing the skills, then you find that they will be applicable anywhere. And you find, you know, people who have done social science or arts, and you know, they have done these things. You are as eloquent as they are. So now, why the school? You know, education is very transformative. Some of us come from very humble backgrounds. We grew up in a village. You know, I keep saying I wore my first pair of shoes when I went to high school. You know, growing in that kind of a thing, it's the education that I acquired. You know, I was lucky to go to one of the best schools in Kenya, Alliance High School, and finally to the then University of Nairobi. And then I didn't disconnect myself from the community. Actually, even besides the KBS school, all my life, I picked up a school in my village, which was a secondary school back in 2003. It was a mixed school with 270 boys and girls. And I left in April 2022, having served as chairman for those years. I left two schools, you know, a girls' school with over 700 girls and a boys' school with over 320 who are still growing, still applying at the same. Because education is very transformative. I have a special interest because I am a beneficiary of you know, coming from a poor background and being able to break that cycle. I believe if we can invest in education in the rural poor Kenya, at some point in my life, I was a founder member of the Moranga County Initiative, where we brought together leaders, political leaders, business leaders from our county, and we said, look, what can we do for our county? And one of the things we have done is education, encouraging each person, go back to your local primary school, become a patron, mentor. You may not need to do more, just by going to that class, and you find some of them still don't have widows, and some of them are still the structures that were there. Even if you don't do more, but you'd be a very an interesting human being. Go to a place where you grew up and find they haven't moved, and not be moved to do something. Just by telling the children, look, I am Dr. Moses. I was here in primary school. I sat on that desk, and here I am. You can also make it. So that is, I have that interest because it's transformative.
Thank you so much for that. And that is very critical, because it's profound in the sense that education has made a difference in your life, and you're using that to see how do you make the lives of others better as an inspiration, but also doing the actual work as the executive chair for the KBA group of schools, and that's commendable. So getting back to the profession of pharmacy to a greater extent, you graduated in 1988 from the University of Nairobi. Was pharmacy your first choice as career option?
Yes, pharmacy was my first choice. I remember when I was you know, choosing careers, my biology teacher, who was a Ugandan scientist, you know, those days, you know, Uganda was not very lucky. There was a dictator there, and people had run away. And my biology teacher was very keen that I take medicine, but in the medical sciences, I fitted better in pharmacy, and I have discovered that even years later, because I like to be able to spend time with the community. I could not imagine spending all my life in a hospital, you know? So pharmacy became my first choice, and I'm enjoying it to my twilight years.
That's amazing. That's amazing. Yeah. Having that passion and following through to this particular moment, that's commendable. Then beyond having chosen pharmacy, you went to the University of Nairobi, graduated from there. Where did you practice after graduation? How has that journey been, and what have been the key drivers and influences for that for you?
Now, when I left university, I wasn't quite sure which of the lines that I would follow. The only one I was sure about was really whether I would really fit in a hospital pharmacy because of my community outlook. So I was either going to community pharmacy, and my first job when I left government, and I worked government for only 8 months. I was the district pharmacist for Meru. Now there are 2 counties in Meru. Then it was 1 district, including Tharaka-Nithi. And I must say that it was a very frustrating time because it was a time when there were no medicines in the hospital. Kenya at the time in 1988 and 1989, after the attempted coup of 1982, somehow things were heading south. So I found myself with a lot of knowledge and very enthusiastic young pharmacist, only to find myself as a district pharmacist, whether in the pharmacy at Meru District Hospital or in the outreaches, who are placing orders for medicine. And my only response was to tell them, "Iyo hakuna, that one we don't have. That one we don't have." I felt I was going to go mad. Did I go to school and spend enough time studying the Schrödinger equation and all the things that pharmacists study, only to come and tell people, "Iyo hakuna, iyo dawa hatuna, we don't have that medicine." So I felt my mind was not going to be stable. So I left, and I was very lucky to join one of the largest retail pharmacy chain at the time. It was called E.T. Monks and Company Limited. E.T. Monks was the chief pharmacist in Kenya in the 1950s. In the 1950s, he was the chief pharmacist, E.T. Monks. So this company, I became the branch manager in Corner House. Corner House was new then. So we had Corner House, we had the pharmacy in Gill House, and E.T. Monks was also supplying laboratory chemicals to schools and swimming pools and all that. But my main job was to run the new, the big pharmacy in Corner House. And it was a very busy pharmacy. I actually found myself serving 150 to 180 prescriptions per day. And those days, pharmacy was a little bit more professional than it is today. You did not dispense medicine easily unless with a prescription. And the pharmacies that were selected or pre-qualified by insurance companies, who are not many, are few. So I found myself working from morning to evening, sometimes without no lunch break. I was so professional, I could not believe leaving dispensing to a non-pharmacist. So if I didn't have a reliever or a farm tech or someone, even a farm tech, I was not very, so I could not leave. And those days, you had to account for the medicines. So I did that, and actually, after 6 months, I wanted to retire. It was a very taxing job. I think I was overtaxing myself. Of course, I trained some people, but I was not quite sure, since they are not pharmacists. And some of the doctors then, the top physicians, they were also very particular. And I had a very good relationship with the physicians in Corner House and the surrounding areas. So I felt, okay, this is good. I was enjoying it, but I found an opportunity to work in industry, and I joined one of the multinational pharmaceutical companies then. It was called Ron Poulenc. It's based with a company called May and Baker. I think many people may remember a drug called MB693, which was awarded drug. It's one of the first sulfonamides. It was manufactured by May and Baker. So I joined that company as a company pharmacist and also as regulatory manager. I worked at one of my seniors. I think she was in the pioneer class at the university, in the pioneer class that started. She was very good. She was the marketing manager. She mentored me very well. She trained me so that I could help her in regulatory affairs. She had she needed a little bit more time with her family than the company would get. She had some need to focus on her family challenges as a regulatory pharmacist, registering medicine, and also we were doing manufacturing, what we call toll manufacturing. We had a number of products like Flagell, the original Flagell. Those days, cough syrups were also quite many. We were also doing some and then was Ron Poulenc.
Yes, you continue.
Yeah, so Ron Poulenc, and I worked in regulatory affairs, and then I also became a medical rep. So I was doing like 3 jobs. I was doing regulatory affairs, I was doing medical repping, or rather, and then, of course, doing the other manufacturing, but toll manufacturing, managing the toll manufacturing activities with the partners, biopharmaceuticals, Glaxo. Of course, later on, when I joined the medical sales, I actually did a very good job. I found I was a very good salesman, you know, and I got trained, and sooner than later, I became the product manager, what we call brand manager. And I launched quite a number of products. Our company was the first to launch the artemisinin-based derivative for malaria, a drug called Paluta. We were the first to launch. And of course, we had very interesting molecules in hypertension, in products like enoxaparin, and even in cancer. We were the first to launch taxol-based medicines for management of cancer. So in the process, then you get involved with the key opinion leaders, the key doctors dealing in these areas, in the area of oncology, in the area of cardiovascular, in the area of anti-infective. So, and I was a product manager. In fact, when I was the product manager, then we didn't have many pharmacists working. I remember there's a time I hired 6 pharmacists at a go. And I was very keen to try and professionalize the medical sales with the professionals, with pharmacists. And then the regulatory, the Pharmacy and Poisons Board then was going through transformation. I remember that is the time now at the Pharmaceutical Society of Kenya, where I had also joined immediately after university, and I had become a council member. And by the time I was product manager, I was the treasurer, national treasurer of PSK. And we were involved in lobbying, you know, to because then there was a lot of infiltration of the pharmacy profession. And I remember it was that time when the Pharmacy and Poisons Board was moved from the Ministry of Health headquarters, and you know, to start on its own. You know, we had people like Dr. D.S. Karanja, who are at the Pharmacy Board then, and the late Dr. Bill Hakiyama, and so forth. So, so they are also now giving, with our influence, giving direction to pharmaceutical companies. You need to register a medical rep,
medical representative,
you know, because you are going to carry medicines around. Who is this person who is going to meet doctors and nurses? So there was that attempt, and and it was a good attempt. I hired like 6 pharmacists, and you know, they did very well. The company did very well. We did very well, and I then became sales and marketing manager, and I grew in the company, and eventually became the regional manager. So managing the whole portfolio of pharmaceuticals in Eastern Africa for the company, and surviving mergers, because multinationals were going through a lot of mergers. So when a merger comes, of course, 1 + 1 is not equal to 2. So some people floated. I survived, of course, because of my performance. At one time, I was running 2 divisions, one dealing with vaccines, Sanofi Pasteur, based in France, the other one dealing with drugs. Then the headquarters was in the UK, and eventually for the region, it came to South Africa. So I have 2 bosses up. Sometimes one company, the vaccine company, has a meeting this week in Paris, and next week the other one has a meeting in Johannesburg or Cape Town, and carrying these 2. When you have two people at the top, all of them want their business done well here. I did that for 3 years, and it was also quite strenuous. Thank God that there was another merger that came in 2000, in the year 99, when now the Sanofi merger between Sanofi and Aventis came, and at that point, the vaccines, I fought very hard to keep the vaccines not to go the merger route, that the local distribution route that the farmer had to. So I was left now with the vaccines. So I managed the vaccine business, and I'm glad I got a very good opportunity. The vaccine business was very, very small at the time. I remember, in fact, even in the Ron Polenk setup, it was like 1/3 of the business. But by the time we were merging, we were 50-50. I launched many vaccines, from the children vaccines, which was then, we went to travel vaccines, we went to things like flu, and before you could launch a flu vaccine, we had to do some studies. So I was working with Kemri people. I remember we were the first to set up in 2004 what we call a sentinel surveillance network for flu. We had to prove that flu virus exists in our setting. And you know, so I got into research with working with the top researchers in Kemri, and so forth, typhoid vaccine and so forth. So then now I became much more known as a vaccine evangelist. I became, I was an advocate and working with them. Then for me, I remember, like for typhoid, there was a time the typhoid, everybody in Kenya or Nairobi was suffering from typhoid. You know, there was typhoid everywhere. Fake reagents, fake, you know, the fake thing started. And I remember putting together, because we had a typhoid vaccine, we had done some study in Bugoma with some top doctors here in Nairobi. We had proved the efficacy of TFMVI, which is a vaccine against typhoid. But how do you get it known? So I put together what we are calling National Typhoid Awareness and Prevention Campaign. Brought together Pharmaceutical Society of Kenya, Kenya Medical Association, the Nurses Association. We brought together Ministry of Education, because typhoid is a social disease. I put together 9 organizations, and we drove a national typhoid awareness and prevention campaign. And the DMS, the Director of Medical Services, then actually launched a campaign at Nairobi Primary, I remember. And the rest is history. We were able to get community to accept to use typhoid vaccine. We were able to get it even accepted for food handlers and so forth. So that way, you know, you can see, okay, I'm selling a vaccine, but we are now discussing an issue. We were actually awarded at the UN level in 2004 in Chicago, United Nations, a conference that is held every 4 years for communication. We were awarded. We divide, and we wanted to be awarded. We got position 3 as a campaign that has social impact. And this, together with my other work in community, led the president, I mean the Mwai Kibaki, yes, third president. He awarded me with the head of state commendation. In 2004, and this was largely because of this national typhoid awareness and prevention campaign, besides other areas. So then I became the head of Sanofi pasture, and I worked as the CEO in charge of 9 countries for 16 years. You know, by the time 16 years were coming to an end, I was offered a position to work in Philippines, and I was at the time now feeling that I didn't want to leave the country. I wanted to work around, and had done what I needed to do in Sanofi. Really, I had trained a very good team. So at that point, there was also Kenya was going through a lot of changes. So that is how I left the industry. I actually went on early retirement at the age of 50 in Sanofi, and went to vie for office of governor.
Yes, I'll get into that. Actually, your political career, that is going to be a conversation. I think that is something that we need to look into. But then before we get into that bit, I know in the industry, much of the work that you've been doing with Sanofi being actually the company you worked with entirely in the pharma industry, basically, from the different mergers that ultimately ended up being Sanofi pasture. That is one story in itself. But at the same time, you're engaging in policy-making aspects, in leadership, professional development stuff. So what are the key drivers that you see young professionals need to look up to and actually take up in these particular spaces? One example, you worked with PSK. How can young people be more engaged, young professionals be more engaged in these professional positions, especially you working in the publication, the research journal, scientific journal itself? That is on one. You served as a treasurer. Then you later became the chair, Kenya Association of Pharmaceutical Industries, CAPI, where I'm currently working as well. But at the same time, how do we get more advances in these spaces? And what are the benefits of engaging with these platforms?
So in Pharmaceutical Society of Kenya, I joined immediately after college. By the way, I was a leader, you know, a vice chair of NUPSA at the university. So I joined the PSK fairly early, immediately. And I joined the council fairly early. I not only served as treasurer, I was also in the scientific committees that were organizing annual conferences, and also getting involved myself. Then eventually I became the editor-in-chief of the pharmaceutical journal of Kenya. And at that time, the PSK office was based at the School of Pharmacy. And one of the achievements that I made when I was treasurer was to get the office out of the School of Pharmacy. We rented an office in town, in the high streets, in Moi Avenue, Sonalak's house. I sublet from a company that was doing some publishing work there, and they were my friends. Got an office there, and we began to run. And the pharmaceutical journal had been moribund for some time because of lack of adverts. You know, if you don't have continuous production of a journal, then you need advertisers. So I requested the society. I was the editor-in-chief. I contracted with some those who are doing they were doing other publications to take up and help us sell space. And I coordinate the articles. And the journal came back, and I was editor-in-chief for quite a while. I think it must have been 6 or 7 years. At the same time, I was treasurer. I was running the office, so we were able to pay the secretary and so forth. All these things have shaped the Dr. Moses you can see, because you are shaping your leadership skills, you are shaping your networking, because your networking is growing. How am I even CEO of Equatorial Nut Processors? I mean, it's a food sector. It's because when I became the founder member of Mwangi County Initiative as the chairman, founder chairman, I wasn't really the founder, but I became the first chairman. I got to meet people in other sectors. Yes. The chairman of Equity Bank then, who is the main director, that's how he spotted me. And when they wanted to get into health, he came looking for me. And actually it took about 8 months, because by then, by the way, I also went back to the hospital sector after 2013. I went to work with the current hospital where I was the deputy CEO. In fact, I was hired to be CEO by some investors from that were going to invest in that hospital, and they needed an independent CEO, and they needed an independent chairman of the board. So I was hired, and I worked, build up the strategic plan for the hospital. Although the deal collapsed at some point, and that's why I exited. They offered me the position to keep on as a deputy CEO, but that was not my interest. I was interested to be CEO. That's how I exited the current hospital. But I had very good experience. When I was there, we were able to kind of, my main focus there was, why are Kenyans going to India? The more the Kenyans go to India, the more they are losing faith in the local healthcare system, in the local doctor, the local. So, and because the hospital was renowned for heart disease, I said, why can't we work to make sure that no one needs to go to India for surgery? And I can tell you, I had a very good experience working with I remember we had a top doctor from India, and we were able to look at a cardiac package, the package, why is it costing X amount in India and it's costing so much more here? I remember putting together a team and actually analyzing what is this that goes on in the theater here that makes our package expensive. And one of the things I learned is that there's a lot of polypharmacy. And we would analyze each drug. Why is this drug needed? To cut down the drugs that need, because the patient. Who are these people who go to theater? When they go to theater, they wear gloves, they wear, you know, all these things, and they are charged to the patient. They need to go to theater. So again, when we talk about quality management systems, they apply again here in management. So the young pharmacists, really, when you come out of university, you have good knowledge on the molecules. You know, you can be able to know how to oxygenate, how these molecules work, which is good. It's the basis. You also have the skills, but now to become impactful, because at the end of life, at the end of a career, you know, besides making some money, because you need to make some money, feed your family, and to secure your future. What is your impact? And for me, as a young pharmacist joining pharmaceutical society, working in the various committees, networking, expanding your networks, because those networks can serve to secure you an opportunity in an area you never thought about, like for me. So, but if you just decide, now I'm a pharmacist, now I have colleagues, by the way, very good friends of mine who left college, and I never heard about them again. You know, they went and opened their chemists, and maybe they are making some money, I don't know. Never heard about them. But when you become part of a society, you know, when you are part of a big thing, then your value is more, and you become more impactful. So I would encourage young pharmacists, yes, pursue, whether it's industrial pharmacy, or it's a research, or it's a community, or it's hospital, or it's whatever. But don't isolate yourself. You can actually discover that you are best to come out when people support you as a talent, and join. And don't say that that's not pharmacy. Like Equatorial Nut Processors, the factory we are building for ready-to-use therapeutic food, that's my idea. There is no other manufacturer here in Kenya, so to speak. The problem of severe acute malnutrition is a global problem, yes, but it's more of an African problem. You know, when I was in the vaccine sector, I started teaching the School of Pharmacy. I was given, then vaccinology was not taught. I am the one who interested the School of Pharmacy, and I want to appreciate Kwantai, who was the dean then, and later on Professor Kibwage, now the Vice Chancellor of Egerton. Yeah, those were my teachers. And when I shared with them, we began, I was doing 2 hours lecture. It was not examinable then. You know, we went on, and it became now examinable. I promoted the idea of having a vaccine center in a pharmacy. I encourage pharmacists to have a vaccination center. And I remember they would always ask me, am I licensed? And I would tell them, look, a pharmacist is authorized by CAP 244 to prescribe and dispense apart 2 poison. 2 poison, yeah. Provided they, and I would tell them, how do you prescribe and dispense a vaccine except you inject it, or you know? So just get yourself trained, you know. And I am not completely satisfied. There is an opportunity for pharmacists to distinguish ourselves even more by offering vaccination. If you go to the US, you'll find that flu vaccine, which is a huge vaccine, you know, it's largely given at the pharmacy. The COVID vaccine should be given at the pharmacy going into the future.
Sure.
So I promoted that, and you know, the vaccinology. I even was then invited by the School of Medicine, the School of Medicine for postgraduate pediatric surgeons, postgraduate pediatric training at the University of Nairobi. They started what we call vaccinology seminars. And because, you know, we would go to promote vaccines to pediatricians,
yeah.
and they were also not very well adequately prepared. So again, I was requested by Dr. Njai, who was the head of that in the University of Nairobi, and Professor Wasuna. And I became part and parcel of the beginning of the teaching of vaccinology. It was then a seminar. I even supervised some students. They would come to my office, you know, and, because we had all the knowledge and information. Okay, I left maybe before it was fully grown. I also worked with the Kenya Medical Training College, again, to review the curriculum for the training of nurses and clinical officers on the area of vaccines, because they used to have what they would call KEPI vaccines. And then they would call non-KEPI vaccines. And they were only interested in KEPI vaccines. And we had to demystify, even for us to be able to get children to be vaccinated with the vaccines that are available, that were available. For example, hepatitis B vaccine, which was available globally since 1982, and was only introduced in our EPI program in 2001. We had to do a lot of work with the Division of Vaccine and Immunization. We had to get the curriculum changed so that people understand, because there is always this view, you know, so there's a lot, and you find yourself now you're working with the teachers at the universities, both at KMTC, at the University of Nairobi School of Medicine, at the pharmacy school, and they are looking at you as the expert in this area. That can only come when you, number one, you need to focus. Number two, you need to diversify. I mean, it may be the opposite, but in terms of you need to have wide knowledge, that means you need also to work with different kinds of people in the healthcare profession, so that they respect you. At no time did I ever feel as a pharmacist that I was inferior in any way. You know, whether it's consultants, you know, who, medical colleagues, we had a very harmonious relationship. And so young pharmacists, sometimes in my time, there was a lot of war between pharmaceutical technology and pharma. I didn't participate in that war. For me, the approach is distinguish yourself. Work with everybody, distinguish yourself, and people will respect you.
Exactly. Thank you so much for that. The key aspect in this is we have to engage to diversify our knowledge base. With the diversified knowledge base, focus in terms of execution on one particular issue that you're pursuing. And I think that is very clear from your experience with vaccines. You're engaging with as many people as possible. You have the different needs that they have. And how do you galvanize that and position yourself as an expert? And ultimately, we are not fighting each other. We are working to make the profession and the practice better for the ultimate beneficiary, the patient. So if we are working towards that, as a professional, distinguish yourself and do the work as a young professional. And that is really, really commendable. And I think this is one thing we have to emulate as young people and young professionals, to see how we make ourselves move the profession and our careers forward. So thank you for that. So as we get to the last bit of this, you've run for governorship for Murang'a County twice now, and unfortunately, these have not been successful for you. So what are some of the things that you're looking at that you are hoping to accomplish from a leadership in the government as a governor perspective? And what are you taking the next phase in terms of political leadership as Dr. Moses Mwangi?
So having served at Pharmaceutical Society and also as the chairman of the Kenya Pharmaceutical Industry, CAPI. Before I became chairman, I was vice chair, and we actually revived CAPI. They had also gone more bad at some point. And then when I was chair, it was at a very, things were changing very quickly. I also became a founding director of the Kenya Health Federation, KHF. And then at that time, because we were headed to a lot of law reforms in Kenya, you know, we also had engagement and we had what we call PPP Health Kenya, PPP Health Kenya, and I was a key leader there also. And Kenya Health Federation, when we came together, the idea was in the Musumkate government, which was very, in my view, one of the most facilitative government that I have seen in my short life, because there was what we were calling the Prime Minister's Round Table. Before the Prime Minister's Round Table, we had what we were calling the Ministerial Stakeholders Forum, MSF, and through the KHF, then we had a seat at KEPSA, Kenya Private Sector Alliance, and we were working on a matrix with the parent ministry, developing policies. Now you can imagine, you know, having been involved in PSK, in CAPI, and all the problems. I remember there's a time as chairman of CAPI, I took the minister to court because of you know, some taxes that were introduced. And then at that point when I was taking the minister to court, I was his appointee in KEMSA as a board director. It was a very difficult decision to take, but we had to do what we had to do, and we managed to get it resolved. So I was involved in a lot of lobby, trying to make the healthcare system work. I still feel frustrated even now that Kenyans are not enjoying the best healthcare they could. We have very well trained professionals, whether pharmacists or doctors. We have many very well trained professionals. But look at the situation. You know, many Kenyans who have means are able to go to India and other places. If you look at the budget, the money, the Kenyan shillings and dollars that we take to the healthcare systems of other countries, nothing wrong. I mean, I don't have anything against India for that matter. But when you think about it, we are exporting jobs. And we are promoting the healthcare system of another nation. You know, so their surgeons are becoming better because they are operating more and more. You become a better surgeon by operating more and more. You know, so these things in my mind, when health became devolved, it became an opportunity for me not to sit and complain, but to go to Murang'a as governor and transform the healthcare system, make it work there as an example. And then, and that was really, although I'm interested in education and I'm interested in poverty alleviation mechanisms or wealth creation mechanisms, but the single most important issue for me as a healthcare practitioner in my generation is the frustration I have that we can do a better job in the healthcare system. That's why I went to run for government. I am not your regular political animal. I cannot be able to fit into the box of an ordinary politician who is able to stand and lie when they know they are lying without batting an eyelid, so that they get elected and move on. No. And in my first run in 2013, we had done very well. By the way, Murang'a people got at the nomination stage, even at the election that they were electing Dr. Moses Mwangi. Something happened. Somebody decided to be Dr. Mwangi like me. But anyway, that is how the nature of politics. So I lost. I was the runner-up, and I thought I would not come again. But 2017, I was there. Again, I became the runner-up again. Quite a closely fought battle. You never get to know whether you won or did not win. When they keep saying open servers, I am sometimes one of those people, there is something in there. But never mind about that. 2022 was a disaster, really. If you ask me in terms of democracy, 2002, we were quite democratic as a country. After that, it's been downhill. And so after 2002, I had drawn my line and said, August 9, 2022, if I don't get the position of Governor Muranga, forget it. I will focus on other things. There are many things to do. So I did not achieve my goal. I still have that burning desire, but I think at some point I was feeling, because I'm a very serious Christian, believes in God. I kind of felt like I'm a man on a mission, and one of my mission is to transform healthcare. I became a healthcare practitioner. I understand a little bit, but when it didn't happen in 2022, I told God, look, I kept on feeling like when I go to see my maker, he will ask me, what did you do?
What did you do?
With what I gave you. Now I have an answer. I'll tell him, look, I tried.
You did the best you could.
I did the best I could. And believe you me, whatever it is, at the moment I am politically averse. I really, where I got in that game, because it's a game. If you do not align yourself, the people at the bottom are not the ones who decide. The decisions
are the people who influence them.
Yeah, they are influenced elsewhere. So it's not a question of how good you are or what vision you have. No, it's not about that. Now I know that I can advise. And I'm very grateful to Pharmaceutical Society of Kenya, because this time around they supported us, and a few of our members won the seats of MCA because the healthcare system in Kenya needs to be fixed.
Needs to be changed.
Who is going to fix it? We need people at the table. For those people to come at the table, we have to work together. And I will be part and parcel. God give me time. And now not to be the one to go, but helping younger pharmacists who can take that space, become. So that is my experience. I think there's a big opportunity to shape the destiny of people's lives by fixing the healthcare system. I mean, what do you think about the pharmacy? Right now, I can walk into any so-called pharmacy chemist and buy anything I want. I mean, it's
no questions asked, no prescription provided.
Nothing. So that's not the pharmacy.
That's shopkeeping. That's shopkeeping. That's not practice, and that has to change. But it's us to make the change. So yeah. Yeah, so that's okay. So actually, I was just going to the last two questions, and these are going to just a brief one. The first one is, from where I stand, I would consider you to have been successful in terms of your professional career and your general life and all that. So what is success to you as Dr. Moses Mwangi? And what can we relate in terms of that journey? That's one, maybe in 2 minutes. Then the last question would be, if somebody wanted to be Dr. Moses Mwangi among the young professionals, what do they need to put in terms of the work that they need to do to become you? What is the kind of secret?
Well, let me say success. I feel satisfied myself in what I have done. I think one can define success as having achieved goals and aspirations in life. One, when I was a high schooler, I wanted to be a pharmacist. I became. when I became a pharmacist, I wanted to work in industry. I worked. When I worked in industry and I was involved, I've been involved in community activities. By the way, when COVID came out, I have been a regular in Oro TV and Kameme TV and radio, speaking in my vernacular, teaching people about vaccines, about all this. I think I've participated in many conversations, even in national media, on this, so that now, in terms of impact, I would like to say, for you to be successful, you also need to be impactful. People need to feel you. People need to see you as a person who has brought some value. I remember I'm a student of Louis Pasteur, and Louis Pasteur, I worked for his company, which he started in 1895, and he came up with the germ theory of disease. To treat is good, prevent is better. And I think in his tube, he wanted written there, Joseph lived. There was a young boy called Joseph Meister who would have died from tetanus, but he made the crude, the first prevention, and he wanted written in his tube, Joseph lived. So in terms of impact, a man like Louis Pasteur, with all the legacy that he left, and he wanted to be remembered for being a pioneer in an area where he saved life. So being a success means that you are not just a statistics. You are not a person who came in and left. There you have left some footprints wherever you go. I left some footprints in the pharmaceutical society. I left some footprints in CAPI. I left some footprints in Kenya Health Federation. I am leaving footprints in my own home county, in my village, in transforming education. By the way, in that same village, there is a hospital there. It's finished. Kaharo Health Center, which I started in '94 with the community. I'm looking forward to when it can be properly operationalized. I think it will be in the current. So my local community know that there is a pharmacist here. They may actually not know whether I'm a pharmacist or not. They know there is a doctor here who has done something in the community. And right now, I am leaving footprints in the field of malnutrition where I am, and the journey continues. So for me, you need to feel good about what you have done. But for you to feel good, it's not about accumulating money. No, it is about impacting lives, impacting other people, including mentoring young people. I have many young people have mentored in different ways. I remember even in Sanofi pasture, we were not the best payer in the market, but people would come and work with me and not leave. Not because of the management style and the ability to mentor other people. Because when other people progress, you feel better. So I would encourage young people. You can be a Dr. Moses, but for you to be, you have to leave your cocoon. You are a pharmacist. Don't sit in a corner. Join the pharmaceutical society in the place where you are in. Get involved in the activities. There's something you have. For me, it was when I was editor-in-chief. By the way, even in the company, I was running what we call vaccine quarterly. I was publishing, of course, through the budget of the company. But I was publishing with a PR communication, what we were calling vaccine quarterly. And I was making sure this vaccine quarterly would report some information on flu. It would report on some area, whether it's hepatitis B or what, and it would be placed in the pigeonhole of every member of parliament. It will be placed in the WHO office. I was trying to influence the opinion makers to be able to make decisions. The other day I was very happy when I met, I was sitting to be trained. Now I'm a medical insurance, and one of the person training there saying, look, the insurance covers this kind of vaccines. We cover baby-friendly vaccines. Now, and I was very proud because I introduced that term. We couldn't get even insurance to reimburse for vaccines like Haemophilus influenza type B, injectable polio, as long as the government one was available. So we had to find a way of influencing, so saying baby-friendly vaccine, where the child gets the vaccine and the mother can sleep and the father can sleep, whatever. So you being able to influence. Somebody wrote and said, to live is a lot more than to look and understand events. When one has the ability to influence events, one has the power to live. So I encourage young professionals to have the ability to influence your generation in a positive way.
Thank you so much, Daktari. It's been a pleasure. It's been great learning from you. And I hope most of the young professionals who are going to go through part of this to watch it and learn from it. And most importantly, this is an ongoing conversation. That is why it's becoming a project by itself. Can we share such stories and impact more people? Because if we can have that learning and use it in terms of positive transformation of our society, then we'll be in a better nation moving forward. The challenges that we're going through will become actually stepping stones to us bringing a better future. So thank you so much. I really appreciate this opportunity, and I look forward to continued engagement with you.